Good morning. Thank you all for coming back. Um, I always worry when I follow either of my parents, there might be a fair bit of attrition. But I think this is a real testament to the continued conversation we're having today. Schools came up a lot in the first panel as being both engine of hopeful innovation in changing kids' healthy habits and their families, as well as being a necessary intervention point if we're really going to turn the tide on childhood obesity in our country. One of the things my father made reference to was a new batch of studies that came out about the impact that diabetes is having on kids' health and wellness. And we now know unequivocally that diabetes, more than socioeconomic status, more than race, more than gender, is a larger hindrance on whether or not a kid will graduate from high school on time. And so this now is becoming not only a real public health threat, but an existential question for who we are as a country and what we value. We were talking backstage a little bit about some of our experiences in school, and as a product of the Arkansas public school system until we moved to Washington, D.C., I certainly had recess twice a day, and I think I thought that was still true. And I was shocked to hear Billie Jean King say that only 2% of high school kids have PE classes, and that no grade in our country, on average, has PE classes more than 10%. That's a really sobering statistic. By the time a kid graduates from high school, if they do graduate from high school, they will have spent somewhere between 12 and 15,000 hours at school. So these really are precious, valuable resources that we have to engender, to habituate, in Dr. Satcher's words, healthy habits and a healthy outlook on life. And I'm really excited to be here with our panelists today, some of whom themselves are students, others of whom are working with our country's schools, to hear about what are the innovations and the interventions that are hopefully going to ensure that the 21st century is healthier than the 20th, despite my father's careful note of caution to the contrary. So, Dr. Proctor, would you introduce yourself and kick us off with your opening remarks, please?
No, gladly. Thank you so much, and thanks for the introduction. My name's Dwayne Proctor. I work at the Robert Wood Johnson Foundation in Princeton, New Jersey. Our foundation made a commitment to reverse this childhood obesity epidemic by the year 2015. And as President Clinton was talking about the different disparities that you see between Hispanic Americans, African Americans, European Americans, others, we also want to address those issues as well so that we make certain that we are supporting the most vulnerable among us to get the changes that we want to see. In 2007, we announced a $500 million commitment to do this for the country. We did that for a few different reasons. The first of which was not to necessarily say we have a whole bunch of money and so therefore this is how much money we have we're putting to the issue. We did it because we wanted to get the country's attention. We wanted to draw attention to this health issue, the most critical health issue that we're facing. As we talk about these terms and we talk about numbers and statistics, we come to realize that this generation of American children may just be the first ones to live sicker and die younger than the generations previous to them. So the life expectancy of Americans are for the first time looking like they're going to decrease for the first time in our history. So we knew it was important to make a loud commitment so that we could raise this issue up. The second reason, though, was so that other sectors could also stand up and make commitments, so that the media can make commitments, that the different industries can make commitments, that schools can get involved, and educators and others. And so by making this noise, we're starting to see that a lot of folks are standing up and paying attention to this issue. It's very important for us to do so. We have good news these days. As of last month, the news was quick to tell us that in California, this state is starting to see decreases in childhood obesity among some groups of kids in some areas, depending on certain age groups. We got similar news out of New York City also last month that they're seeing at least a 5% decrease in childhood obesity. And even here in Riverside, California, it's been a 2.5% decrease in childhood obesity. And knowing the economic state that we're all in, knowing that it's easier for families to buy food of lower nutrient value because it's more it's more affordable than healthy fresh foods that could be available to them. Knowing that we have these situations where children aren't getting enough physical activity during their days, and seeing that California, New York, and Riverside, California, that the leaders in these two states, in this community, stuck with it. They stuck with it, and they stuck with schools, and they started making changes in schools. And we think that that may be leading to some of these decreases that we're starting to see. And so that's been very exciting to watch along those as well. We support the Healthy Schools program, the Alliance for Healthier Generations Healthy Schools program. It is one of our most successful investments in schools thus far. Over 12,000 schools are now engaged. In the very first year, 230 schools were funded. And after 12 months of making these changes to their schools to improve the food environment and the physical activity environment, 27 of those schools were able to garner the Bronze Award, 10% of those schools. Some might say, well, that's a very low number. Out of 230, you only had 10 that rose up to get a medal. But it also goes to show how hard these changes are to make in these schools. 5 years later, though, we have over 275 schools that are getting bronze, silver, gold awards from the Healthy Schools program. And so that's 1,000% increase over 5 years.
And we now have more than 10 million kids in these programs as part of the Alliance for Healthier Generations school initiative. And we have 55 million kids in school on a given day in this country. So we are making real progress. I mean, that's a real significant percentage.
Absolutely.
Thank you very much, Dr. Proctor. Dr. Wechsler.
Hi, my name is Howell Wechsler. I'm the Director of the Division of Adolescent and School Health at the United States Centers for Disease Control and Prevention, and we work closely with state and local education agencies and health departments to help them improve health-related policies and programs in schools. I'd like to give you 5 brief points to set the stage for the rest of our panel. Number 1, schools have got to be greatly involved in activating wellness. Young people face many health problems beyond obesity. It includes teen pregnancy, violence, substance abuse, and many others. Schools did not create these problems. They should not be expected to solve these problems on their own, but school is such an important institution in the lives of our young people. We cannot solve these problems without schools playing an important role. Number 2, promoting health needs to be a fundamental part of the mission of our schools. This notion is deeply rooted in American history, but it has been forgotten by many educators and policymakers. They obsess over standardized test scores to the exclusion of everything else that is important for the lives of our children. School health programs, as a result, are increasingly marginalized and typically among the first things cut, even though, as you've heard referenced several times already this morning, there is a strong and growing body of scientific evidence that documents the links between student health and academic achievement and the positive impact that school health programs have on academic achievement. 3, we know what needs to be done. We could always benefit from a lot more research, but the truth is we already have a ton of knowledge about exactly what schools need to do to have a strong impact on the health of students. The problem is a failure to implement that which we already know. Both CDC, the Alliance for Healthier Generation, and many others have tools that lay out a very clear agenda of effective health promotion practices for schools. We know what needs to be done. The science is strong. 4, promoting health needs to be integrated into school accountability requirements. It is not enough to do nice events like health fairs or fun runs. And if you're a celebrity or a sports star or a corporate leader and you want to get more involved and help, well, doing these kinds of events will make a nice photo op, but it's not going to lead to lasting improvements in students' health behaviors. And we can't depend on principals or teachers just voluntarily embracing health promotion when all the pressures and incentives coming from above are pushing them in another direction. We will only make progress if we systematically build into school governing practices strong accountability measures that require or incentivize schools to support health policies and programs. Things like requiring schools to include health-related objectives as part of their state-mandated school improvement plans, requiring them to have health counselors, health coordinators, and to conduct science-based assessments of their health policies and practices. To have meaningful impact, we've got to make these kinds of systemic changes. 5, and finally, no progress will be made unless all of us speak up. as parents, students, teachers, healthcare workers, corporate leaders, as Americans, we all have an immense capacity to influence educational policies and practices in our communities and beyond. Now, everyone who's come to this conference probably agrees that schools need to do more about health, but across the nation, many of the people making decisions about school policies just don't get it. So it's up to all of us to cite the scientific evidence and to speak loudly and strongly so that those policymakers will understand that it is no longer acceptable to marginalize and to cut school health programs. We're just not going to make progress in activating wellness for the next generation unless we all speak up.
Thank you, Dr. Wechsler. Next, a student who certainly is speaking up and ensuring that her voice is heard in her school and beyond. Anita?
Thank you. Hi, my name is Anita Rao, and I'm a Youth Advisory Board member of the Alliance for a Healthier Generation. The goal of the Alliance is to reduce the prevalence of childhood obesity by the year 2015, and to also encourage the youth to lead healthier lives. So when the Alliance recognized that there was a need for a child voice when attacking the problem of childhood obesity, they created the Youth Advisory Board, which is comprised of 20 young individuals from ages 8 to 17 who all have a common passion to overcome this health epidemic in their local communities. So before I joined the Youth Advisory Board, I was already really interested in public health. I first started off getting interested in adolescent sleep patterns, and I soon came to realize that sleep affects all aspects of life, even childhood obesity. So we know that we have diet and we have exercise, and these are key components to our overall health, but I sometimes feel that we overlook sleep education when we are dealing with this issue. I started a group called Choose Health, which stands for Childhood Obesity Overcome by Sleep Education, Healthy Eating, and Aerobically Loving the Heart. And this group, the goal of this group is to not only promote diet and exercise, but to really promote practicing healthy sleep habits too. When I came across the Alliance, it was like a dream come true. It was this organization that could provide me the support I needed to turn my efforts into something sustainable, impactful, practical, and it was also this opportunity for me to incorporate some of the knowledge that I had on sleeping healthy into the Alliance's main message, and that's what I've been trying to do as a board member. Schools are really great places to improve the lives of kids because kids spend so much time in schools. And one thing that I think the Alliance does really well is develops tools that we can use in schools to improve the lives of kids. One of the materials that they have is the Healthy Schools program. And I have been using that, I'm currently using that to improve the well-being of my school by implementing 4 school wellness councils in 4 schools in my district. And I'm also working with Baylor College of Medicine's sleep professionals to try to incorporate some of that sleep angle that I think we need to supplement the tools that the Alliance has already given me. I am really fortunate to be a part of the Alliance. I think it's a really great organization, and I really would not have the credibility that I have today, nor the tools to promote what I truly believe in, getting kids to lead healthier lives. The staff on the Alliance is fantastic. I can call them up at any hour of the day and talk to them, bounce ideas off of them if I feel that I've hit a barrier. And most importantly, I think the fact that I have 19 other like-minded individuals who have the same passion and same drive that I do really is inspirational, and it keeps me empowered to do the same thing that I do every day, the thing that I love to do, which is making kids' lives healthier. Thank you.
Thank you. And Anita, you find your cohort inspirational. I think you can tell from the applause in this room how inspirational we all find you. So thank you very much. Pete.
Yes, my name is Pete Shankle. I'm the Wellness Coordinator of Durham Public Schools. And I want to thank everyone here for allowing me to follow this young lady. Jeez. We've been sitting over here talking, about just how great you are and how wonderful you did. Today I get to represent two organizations, Durham Public Schools in Durham, North Carolina, and the Alliance for a Healthier Generation. Durham Public Schools is a system of 54 schools with approximately 33,000 students. However, 60% of our students are on the free and reduced lunch program. If you're not familiar with the Alliance for a Healthy Generation, you've heard a lot about it in the last couple of speakers. You know, their goal is to fight and eradicate childhood obesity. 3.5 years ago, a young lady, Siobhan Simmons Wright, who is the manager of the state of North Carolina, the representative from the Alliance, came into my office. And she said, Pete, what can we do, what can the Alliance do to help Durham Public Schools fight obesity and promote wellness? You know, I felt pretty good about myself. All of a sudden, someone from the Clinton Foundation walks into my office and goes, what can we do to help you? Well, little did I know at the time that thousands of school systems throughout the country were benefiting from the Alliance of a Healthy Generation. That ego of mine, deflated real quickly. Well, 3.5 years later, 3.5 years have gone by with this partnership with the Alliance. 3.5 years of making Durham Public Schools one that we fight obesity. We fight diabetes in our community. Every year we try to do something a little bit different. Throughout the years and the help of the Alliance, we have revamped our wellness policy. We now have one of the most aggressive wellness policies in the state of North Carolina. Every school in Durham Public Schools has a wellness committee. Every school in Durham Public Schools must turn in a wellness plan with long-term, short-term goals, the activities that they will be using to achieve these goals, plus measurements to make sure that these goals are fulfilled. Without the Alliance, we would have never gotten to that point. Probably one of the most remarkable things, and I really like sitting next to these young guys here, because we are one of the few districts that have started a student shack, School Health Advisory Council. Our students in Durham Public Schools now have a chance to have a say-so in the administrative decisions regarding the fight against obesity and promoting wellness. Throughout the years, we have schools that are now being recognized by the Alliance. We have 6 schools that are bronze recipients. We have 1 Southern Durham High School that's a silver. We hope that throughout this year that all of our schools, and that is a goal. Remember now, we had 54. Our district policies now give us a chance to have all our schools apply and receive either bronze or silver recognition within this school year. We now have a superintendent who's made it a part of his strategic plan to promote wellness and fight obesity. Every school in Durham Public Schools must take the Alliance assessment tool to determine where we are, how far we have to go, and the activities we need to promote wellness in Durham Public Schools. The Alliance has made a difference in what we do every single day. I love being a part of the Alliance. Our schools, Siobhan Simmons Wright, they know her as well as they know me, all 54 schools. In fact, Durham Public Schools should pay Siobhan Simmons Wright for the amount of time that she spends with us.
We're just happy that you let her continue to come into your office even though you knew she was visiting lots of other schools. So,
but she didn't tell me that until later.
No, indeed. So thank you, Pete.
With that, I would like to once again thank the Alliance for everything they do for us and everything and the things that they have done to make us a better school system. Thank you.
Thank you. And Pete, you did just fine following Anita, so thank you. Reed.
I'm number 5. Thank you, Chelsea. Hi, I'm Reed Alexander. I am so honored to be up here as a champion for the Alliance for a Healthier Generation and the Clinton Foundation. You might also know me if you're a fan of our show on Nickelodeon, iCarly. I play the very notorious villain, so yikes. It's a lot of fun. It's a lot of fun. I also have a website, coolbites.com, which I launched 2 years ago. I was overweight, was lethargic, I wasn't feeling well. I really needed to make health a priority, especially in tandem with my family history of diabetes and heart disease. I did a lot of research. I really dove into it. And one thing that I discovered was that there was nothing out there for me to plug into from a kid's point of view. As a result, I sort of had to blaze my own way. It was really a lot of fun because I was constantly blogging to myself, coming up with notes and tips and guidelines, getting in the kitchen. And as I was sort of taking control of the reins, I was grabbing my spoons and whisks. I'm a major foodie, so I love finding ways to swap out ingredients, lighten up recipes for dishes that I love. Throughout the process, I lost weight. I began to feel so much better, gained back that confidence, that energy, and as a result, I wanted to create my site, Cool Bites, as a destination for kids and families, hopefully to spackle up this hole that I had originally encountered, and of course to put a fun spin on what is a very serious topic. About a year and a half ago, I joined the Alliance. I'm a huge fan of its message. Together, our goal is empowering kids and families across the nation to take health into their own hands, especially through the tools that the Alliance is constantly providing to millions. Together, we've been able to visit schools, meet kids and teachers and faculty, take stock of incredible changes taking place on the scene. These are overall revolutionary, positive approaches to wellness that I think are very eye-opening, very inspiring for me, especially when we get to see firsthand fruits and veggies and salads, whole grains on that cafeteria lunch line, the changes taking place in the gym, and the pride that pervades the student body in their schools for their accomplishments. Just on a personal level, one thing I always found very exciting was our food service director at PS2 in West New York, New Jersey, Sal Valenza, introduced me to yellow watermelon, new habit. Who knew? Very exciting moment for me. And constantly, yeah, well, you can tell those moments are taking place on campus, especially when the kids have an opportunity to ask questions during our interactive demonstrations, when we really get to chat back and forth. You know, I realize, and I'm so grateful for the fact that they're such huge fans of our show, but I think what's always very surprising and to me so fascinating is that those questions focus on how I exercise, what I cook and eat. And I think that's hard proof that kids are hungry for leadership. They're hungry for knowledge on how to improve themselves. And therefore, it enables us to sort of erase from our lexicon couch potatoes, because the goal is obviously to motivate America's youth through informative examples, education, as well as through the internet. Social media opens a great door, a conduit for all generations, especially mine. We get to have a great conversation through social networking and media. It's really a global dialogue, and it feeds back into one key principle that I always find, that conversation is so much bigger than weight. It's really about how we deserve to live well as a society.
Thank you, Reed.
Thank you.
We have questions coming in to our Facebook page and on Twitter that are going to appear down here. And so if you see me trying to scribble them down, they're coming in at a somewhat exciting clip. That's what I'm doing so that I don't lose track of them, although I will take the prerogative of being the moderator to start with one of my own initially. Clearly, there's so much good work happening around the country, and for the Alliance's part, I'm very proud of the role that we're able to play to help empower students like Anita, although I get the sense she didn't need much empowering, and to help give Reed an even more robust platform so that more students and kids can be inspired through his inspirational story of transformation. Yet, clearly, as we heard in the first panel, there is a responsibility of government, of local governments, whether it be the county school district, for example, in Durham, or at the national government level, whether it be from the CDC or the U.S. Department of Agriculture that actually sets the food policies that influence what gets served not only for lunch, but for the students who are on free lunch programs, who then have access to free breakfast programs, or students who are part of federally funded after-school programs who are also getting their snacks from that same kind of pocket of nutrition. That's often, 50 to 80% of the calories that a kid will consume in the day. So, for Dr. Wechsler and Dr. Proctor, and for you too, Pete, what really is the role of government now that we know what works to help learn quickly from that and to disseminate that across the country? Dr. Wechsler.
Yeah, I'll start with that. It's important to realize what the Alliance does. The Alliance has people who work with folks in the schools and link them to the best information, the best resources. It's a brilliant demonstration of what foundations and nonprofit organizations can be doing. But you don't get anywhere, you don't make any progress in the Durham public schools unless you got Pete there. And many, many school districts across the country don't have a Pete. And even with his own districts, he was telling us they only have physical education 1 day a week. So Pete's lacking a bunch of physical education teachers. So it's clear that the government's role is to provide the infrastructure. And then corporations and foundations and nonprofit, non-governmental organizations can come in and give that extra value, link the infrastructure people with the evidence of what the most effective practices are, and that's how we'll have success and move forward.
And Pete, what about from your perspective in Durham? Are there other school districts near you that are coming to you now to ask for your advice and help as to how they too can become healthier?
We have become the leader in North Carolina. And we have other counties that are constantly calling myself, the wellness coordinator, Mr. Larry McDonald, who's the director of health, PE, and wellness, and athletics, and driver's ed, and it's crazy. So yes, we have
driver's education is also important for health.
I know.
Yes.
But yes,
do you have
we have
teenage
many
kids?
people email us, call us on a constant basis, wondering what we're doing, how we go about doing these things. And once again, I got to bow to the Alliance for a Healthy Generation. I'll give them all the advice I can on the local level. If you're not a part of the Alliance, you need to join, because they can give you the tools and the toolkit necessary to improve your school system.
Dr. Proctor, what you mentioned earlier that we are starting off 2012 with some good news, that in New York City, where my husband and I live, we're slowly ameliorating the burden of childhood obesity. Here in California at the state level and also in nearby Riverside, there are signs of not only positive changes but positive momentum. How do you think about, at your role at the Robert Wood Johnson Foundation, finding those real innovations, like the one or two things that make a difference, and then shouting those out and giving people the funds to pick those up?
We really need to find a way to tell the stories better. There is so much going on across the country in schools. One reason why the Healthy Schools program is so successful is that some of the solutions that are generated at the school. So it's not that this program forces schools to do things that they find uncomfortable. They're actually doing things that they find comfortable. We hear stories about the Monte Vista School in Albuquerque, New Mexico, where it's an elementary school. And the young people understanding that it's about energy balance, that the calories you consume also has to be burned off through physical activity. And so they created this thing, and watch this, it was something you probably would see on Gilligan's Island. Do you two know about Gilligan's Island? Okay, thanks, Pete. I'm so glad Pete's here. So it's a bicycle that you ride for a while, but it operates a blender for your smoothies. So you put in the time on the bicycle, and then you can have your smoothie and things like that. But this is something that they came up with. There's other schools across the country that have found ways to use their facilities for physical activity with the staff of the schools in the mornings, so that they all come in and it's voluntary, and they do these things. These stories are happening all across the country. Our kids are absolutely brilliant. And what I love about this is that these aren't schemes. These are programs that really are setting the environment and making it the right place so that kids can be active and they can eat right all day, so that they can do those things, which are the two most important things to do.
And then it's teacher to teacher, and superintendent to superintendent, and PE teacher to PE teacher / driver's ed teacher.
That's right.
But it's that same peer-to-peer learning that we heard is so effective in the first
And
session.
you need that too, because when the staff and the faculty and the others, one, show that this issue is important, and it is important. We are facing an epidemic here, and so, but when you have them also modeling the behaviors, so that the young people can see people who they hopefully admire doing the same things that we want them to do, then it's good for everybody. It's good for the staff. It's good for the students as well.
Reed, clearly, you talked about how many kids now are on your website and are inspired by your story. And I think it's a really remarkably courageous thing that you've done to expose your story of starting in one place and now being somewhere else, and that you're willing to inspire others through your own transformation. One of the questions that came up earlier on the screen that you alluded to was a challenge for you was how, as a young person, did you stop snacking all the time? Because we know that snacking is actually a pretty significant challenge for a lot of kids. One of the pieces of research that the First Lady's Let's Move initiative co-sponsored showed that the average kid from a middle-class family in America now snacks 3 times a day. 30 years ago, the average kid snacked 3 times during the school week, so a little bit less than once a day. I mean, that is a significant change in our snacking patterns. So not only what we're eating for breakfast, lunch, and dinner, but what we're eating in between meals. Could you talk a little bit about maybe that challenge for you?
Completely, absolutely. I think on a personal level, you're right, especially when we think about what a school is. It's such a great focus group. How many thousands of students have so many different patterns, whether it's they're heading to their locker or they're heading home at the end of a long day. Just on a personal level, for me, I can speak to the fact in terms of, on the cooking side, on the snacking side, the tips that I find are really successful. First of all, I think about what I'm eating during the day. I think a lot of what we have to focus on are those basic food groups. Obviously, the pyramid was revamped, but still the same components have held true when we talk about protein, when we talk about filling up. In the schools that I visited, especially with one of our luminaries, Sal Valenza, who I mentioned a little earlier, I was really excited to see that the students themselves were passionate about picking up an apple or a whole grain bread. So when we talk about those different snacking choices, there are recipes that we can make at home, whether it's our homemade version of a granola bar. Obviously, there are so many options now, but then it opens up, I think, a different part of the discussion. Are these foods accessible? And that's where, at least on a school level, the Alliance is really coming in, because I've had the chance now to visit several schools and meet several hundred kids at a time, and they are aware. And most importantly, I think it's about getting to the core of the dialogue and creating a desire, which feeds back to such a huge umbrella of components, whether it be snack time or cooking or lunchtime in the cafeteria or heading out to the track field at PE.
One of the Alliance schools I visited in Brooklyn no longer gives out gold stars for really good essays or spelling tests results, but gives out red apple stickers. So if you have a really good result, you get a red apple. And I've thought a lot about that. It's something that seems rather banal, but it actually conveys a really profound message. That your academic health relates to your physical health and mental health, as Dr. Satcher was talking about so eloquently earlier, and also that this is something that we value. Not that we're, ever going to think that a kid shouldn't value gold bullion or a star in the sky, but that we really value apples and we really value their health. Anita, what are some of the challenges that you have faced in your school as you try to talk to kids about, A, why they should care about this, and B, maybe why they should make different choices?
Yeah, I sometimes say that it's actually easier talking up here in a setting like this than it is talking one-on-one to a teenager, because if you don't want to listen, you'll sit here and politely nod, but they will just blow you off. So, yeah, so that's a teenager. But one thing that I found as a challenge is, sometimes getting across to peers that this is a real issue, because especially in high school, by the time kids get there, they already have, the foods that they like to eat, their sleeping habits, the amount that they exercise. It's really hard to make a change at that level. And so that's a challenge that I've seen is really hard. And also, really, even at a parenting level, parents don't like to be told how they should parent their kids. And, sometimes, a lot of times, the traditions that people have in their families conflict with healthy choices. I know sometimes eating Indian food, it's not the best. A lot of it is healthy, but a lot of it isn't. And so you're trying to find kind of that middle ground between what's healthy and how do you still have your own personal space. So those are some challenges that I've encountered. But I think one thing that's really great about being this age as a teenager is when I'm talking to kids, I can always argue the point, and I'm sure Reed can also, that we can kind of relate to what other kids are going through. I mean, we definitely suffer sleep deprivation. We, snack time to time too, I bet. And so when we talk to kids like we understand what they're going through, I think the message sinks in a little bit better sometimes. And so that's what I try to do, is also appeal to a kid's nature. If it's a kid who wants to excel in their studies and max out on their SAT scores, then tell them how physical education and getting a good night's sleep actually does improve those things. It's not a myth. It actually, helps you retain that knowledge. And if it's a person who wants to become a star athlete, then right there, that's a direct influence on how physical activity and eating right really play a huge role. So I think just appealing to what not only kids, but everyone in general, parents, how kids will be, maybe more happy at home, that they'll be more interactive, and teachers, they'll be participating in class, your test scores will improve. So talking to different levels of the community at a level in which they understand, the things that they want for the kids around them is a really important tool to use, because staying healthy improves all aspects of life.
Anita, you mentioned parents, and we've had a couple of questions come up about parents, and so I'd like to read one and then just throw it open to the panel. How do we educate parents to change their unhealthy practices in order to support their kids? So I don't know if, Dr. Proctor,
I'll start.
Just because you're sitting next to me.
And I'll just throw out one. There's probably 12 or 14 good ways to approach this. But educating the children first often help. I would think that of all the different prevention programs that they have in schools, my kids definitely, if they saw me do something like smoke a cigarette, they would stop me because they've got the education and they understand it. If I got in my car and didn't put on my seatbelt, they would say something because they've been educated that these things are there. So sometimes helping to educate the students will help to educate the parents, educating them on nutrition facts, about the amount of fats they should have, the amount of calories they should have typical in a day. If they're shopping with their parents, I've heard kids tell me, I told mom not to buy this because it had too much sodium in it, and choose something else. So my pick is educate the kids, and the kids will educate the parents too.
Dr. Wechsler?
Yeah, that's brilliant. There is a lot of educational efforts that can wind up being hollow because there are many, many communities where you can talk all you want about how the children need to get fruits and vegetables, but if there aren't opportunities for the parents to go out and get fresh produce, then what are they going to do about that? So there are many exciting ventures, some supported by government, some by foundations, that are going at those food deserts and are providing loan opportunities for businesses to open up in inner city communities. There is no lack of innovative, creative thinking. We just have to have the will to go out and create communities where all parents can act on the information they're receiving.
Yeah, I think that parents sometimes fall in the middle of our whole society. Kids can go to school, and you can reach out to kids that way, and you can talk to organizations at a different level by attending conferences and things like that. But parents sometimes fall in the middle. How do you get the message down to the parents? From a school level or from a level that's actually higher. And so a big issue is getting parents aware that there is an issue. And I think that definitely educating the kids is a huge way to get through to parents. But also, if people where do parents visit day to day? They will go see their physician, very often. They will go to work every day. They will participate in possibly the PTA in their child's school. And so any place where you see that a parent is going to visit regularly, I think is a place where you need to try to get that message out to the parents. Otherwise, they're pretty much left in the dark. They don't know that there's even an issue, or that their child is going through a problem that, you know, is not just a teenage problem, but it's actually can be something that's being affected because of poor health. And so I would definitely say that getting in the work setting a more active type feel going on, a walk or taking a PA break, you know, in between, you know, every hour or so, is some way to get parents understanding that their kids really, really need that kind of help. And also, I'm pretty sure parents experience sometimes fatigue and things like that when they come home. And so relating it on a personal level, saying, look at how you're feeling now. Do you think if you practiced healthier habits, wouldn't your kids feel better too when they grew up? So relating it to a personal level is also a really good way to get through.
Pete, what do you do at the Durham school level? How do you, from a school perspective, engage parents on questions related to health and wellness?
Yes, ma'am. From a grassroots level, anytime that we have physical activities, Hope Valley Elementary School in Durham did a marathon in which the kids went home, walked or ran a certain amount of distance a day. The parents signed it. The parents went with them. Okay, that was your key component. The parents went with them in many cases. And then the last day of the marathon, they came back to the school, did the last mile, mile and a half, whatever it was, and over 200 kids got involved in that marathon. That day, which they finished the last mile, parents were there in droves to be a part of that. So whatever we try to do with the kids, we try to include the parents. So not only are we educating the kids, we've got the parents on site during that process.
Yeah, you know, for me, I always think about almost like the example. It has been known to happen where somebody says, hey, Mom, can I have $25 to go to the mall versus let's go see a movie together. So I think when we take that sort of same mentality and idea and say, let's take a ride to the supermarket together and be sort of adventurous, or to the farmer's market. Let's take a walk and pick out 2 or 3 ingredients, whether it's coming from the parent's end or from the kid involved or the teenager, whoever it may be. I think it starts to inspire the thought process, hey, what if we get into the kitchen together and each have a little job and then take dinner to the table? I mean, we all have such busy schedules now, it's difficult to say, let's set aside 7 nights a week to gather around the table and you know, bring 3 great entrees and side dishes to all of our hungry palates. But, you know, if we set aside 1 night a week, or even theme it, even involving friends, movie night, game night, a picnic, it does give that element of interaction that I think then, you know, sort of all has us on the same wavelength, because there's inspiration there.
What do you think school's role is when students aren't in school? So during the summer months or the weekends, what role do you think schools can play to continue to support healthy habits and choices then?
I think there's 2 things that are critically important here. One is being able to open up the school grounds in the off hours, so that, I mean, to live in a neighborhood where you may have a place where young people could participate in sports or just gather or run or any of those things, and to have that locked off and have that right in our community when we're facing this epidemic is really a very big problem. And so that's something that schools can do in the off hours. We have another issue with poverty in this country, and poverty is related to obesity. And we know that many kids, they get the majority of their meals they may get from their schools during the school day. I'm not certain how schools can provide foods to those hungry students over the weekends, but finding ways for the community to come together where public-private ventures are paying attention to this issue of making certain that these young people can have access to food, just food, good food that's good for them during these time periods in between schools, I think will make a very big difference.
Dr. Wechsler, did you? Oh, you were just...
That's good, because I liked your answer on the last question better than mine. So,
yeah, so I think speaking from a school student perspective, school doesn't really stop whenever we get out of school. There's actually still a lot of activity that goes on. But I think that if you focus on the kids who are at least in high school, you know, a lot of times they're looking for things such as community service hours or, doing something to better the community and things like that. And so they stay in school a lot of times to get those things taken care of. Also, our drama club stays after school. Athletes are still there all the time. And I think during the summer, say when an average kid is sitting at home and their sleep cycles are messed up and they grab from the fridge whatever is available and they don't want to exercise, I think schools can step up and offer a place where kids could get together, because I know during the summer we don't see each other all the time, especially the students who can't drive, and it can get a little bit lonely during the summer and long. And so if a school can offer a place where kids can come back to get together, at least if they open up the grounds, then people can come back and play baseball, during the summer, or they can play some soccer or something where we can make it interactive for students to get together, because I really think that we feed off of each other in terms of peers and the things that we like to do. And so if we're gonna call peer pressure a bad thing, why not spin it in a positive way and take those kids who like to exercise and take them back to the school grounds, open those up, and get other kids involved.
Reed, what role do you think positive peer pressure can play in changing this dynamic for the positive?
It really reminds me of your question about the role schools can play in the off hours, that these are forums for us to get to meet and know each other. Just like this panel, we've had the opportunity to chat, share ideas. I think the exact same thing takes place in school. And when we try and work in these general ideas into some form of curriculum, or to impart somehow to these students their own positive principles and open up this bond for communication, then I think it can also have a very counterintuitive effect to what most of us would probably, I'd say, most traditionally perceived to be the case, which is that peer pressure, means that someone's going to be a naysayer and we're all going to go along for the ride. I also think that in the case of feeding back into your question about off hours and going back to the idea that these schools are a meeting place and a common bonding for these students, challenges sometimes. In summertime, how many steps can we all take by the time we reconvene in the fall? Let's see how we can engage the student body. And then the students are cyclically inspiring each other. Hey, guess what? Let's take a walk, and we'll both hit 10,000 today. I think that's something that we can all take away and continue to apply on a daily basis, and that really inspires that positive peer pressure.
That really inspires me. Thank you.
Thank you. I'm so glad. I appreciate it.
In our last few minutes, I just would like to offer you each the chance to share sort of one idea, thought, suggestion, vignette, or question that you think the audience should go back and convey or ask to their local school or their local school district, or a policymaker who influences their local school or school district. Dr. Proctor?
I would say for all of us who have not attended a high school, middle school, or elementary school recently, taking a walk through those schools would be very important to do. Take a look at, it's so different now. Vending machines on every corner of every hallway. The cafeteria food sometimes in many places isn't prepared there in the cafeteria. Physical education, as we heard, doesn't exist in most schools. But some of us don't know that because we don't live that experience and we don't see that. And for parents, joining school wellness councils so that you can have an influence on what foods are served or what things you think the school should attend to when it comes to health. I think those things would be very, very helpful to do.
Quick anecdote of one of my favorite practices I've seen. School in Connecticut, they had this problem with the elementary level because all the parents wanted to bring in gobs and gobs of cupcakes when it was their kid's birthday, and they didn't know what to do about it. And finally, they landed on a great idea, and that was, instead of having cupcakes on the kid's birthday, what Johnny gets to do on his birthday is he decides what the kids are going to play for the extra 15 minutes that they go out and play. Some simple ideas like that. One quick point I want to make. We heard on the earlier panel, people were saying that it has to be a grassroots effort and people have to find it within themselves and get the motivation and encourage their neighbors. Absolutely true. That's absolutely essential. It's not enough. Unless we have the infrastructure, the environment in place that makes it possible for people to make healthy choices, and nowhere is that more evident in schools. We've got to have Pete. We've got in place, we've got to have the physical education teachers, the nutrition educators, the sex educators. They all have to be in place. Otherwise, we're not going to make progress.
I like everyone to think about what their role is in the community. In some way or another, you're interacting with a kid, whether you know a parent of a kid, or you're a physician, or whether you're a teacher of some kind. But in some way or another, we can reach out to kids. And I think sometimes the biggest issue is that people don't even know that we have a childhood obesity problem in this country. And that is the scariest thing, because people, if you don't know it's a problem, then what are you going to try to do to solve that problem? And I think that if you can somehow get get kids to understand that you are on their side, because a kid encounters parents, teachers, other peers, physicians, pretty much every day or sometime, during the week. And so if you can figure out what your role is and understand that this is really an issue, then you can take that back to a kid and they'll feel that they have everybody around them on the same page, and that'll definitely help them make changes in their own lives.
Thank you, Pete.
One of the things that a principal once told me when I first got this job is, Pete, I'm not sure if you can change culture. I'm not sure if you can change the culture of the fact that in the South in particular, we reward with food. Everything we do in the South, I mean, family reunions, family outings, it's something regarding a food base. Can you change culture, Pete? And I think the answer is yes. We must change the culture of the food that comes into the schools, whether it's prepared by the Child Nutrition Services, the outside foods that come in, such as birthday parties, fundraisers, vending machines. And in Durham, we have done that. If we can do it, it can be done throughout the country. We must change food culture throughout the country.
Reed.
I think so often when we talk about change, leaning into the wind, it's sometimes it sort of gives us a little feeling of trepidation. What's on the other side? I think if we can start to engender that proof, if we can, bring to the principal the evidence. Hey, guess what? My 5 friends and I have started a fitness club, and every single afternoon we're adding on another friend of ours from the PE squad. You know what I mean? Or if it's something as simple as getting motivated, stepping into the cockpit and finding ways on a statistic level and then on a personal level to inspire that change in terms of friends. It comes from all different strata. And when we can all sort of converge on this basic goal, I think, we talk about pass and go. It's really success.
Thank you. I certainly feel better now than I did at the beginning of the panel. I would like to thank our panelists, and then I'd like to ask Reed to stay on stage with me. Thank you very much. Thank you so much for being here. Thank you. Thank you. And then, wait, quickly before we break, I'd like to ask Lorena Garcia to join me on stage. Oh.
No, nobody leaves.
Wait, don't wait. And
don't, close the doors, close the doors.
How are you?
Hello. Thank you.
Thank you.
Both so that Lorena and Reed can share quickly about an exciting commitment they're making with the Alliance to help bring some of Reed and Lorena's exciting recipes to our schools, but also so that Lorena can tell you about what we're having for lunch today. So I'm going to hand it over to you quickly. Thank you all again.
Thank you so much. Thank you so much for not leaving yet. I know everybody's hungry, and believe me, we've been cooking for a while back there. I just want to thank the Alliance and the Clinton Global Initiative for this wonderful invitation. To me, it's about what actually lunch says. Food matters, right? And I think that we are what we eat. I am a firm believer that we need to be responsible in the way that we cook as much as the way that we eat. And what I wanted to bring you today is not only my commitment to write recipes and create recipes for the schools right now in Miami, hopefully bring it nationally, and my dream come true will be to bring it across the globe and obviously to Latin America, Venezuela, which is where I come from. And very quickly, what I wanted to show you is a little bit of the Latin spice that I bring to the table, that we're able to make great food that is good, that you can eat every day, and that you're going to be able to find those wonderful notes of spiciness and citrusiness and, you know, this indulgence that you can find in your food only by paying attention to the ingredients, the way that we make them, the right combination, and the right process of cooking. So that's what I'm trying to bring to the table, not only for our kids, but also for the parents and for the people that are actually making the food. So I'm not only committing to write and create great recipes that you know, carry that culture of Latin cuisine that I bring so much to my heart, but also to train the staff, to bring, you know, those knowledge to the people that are making the food for the kids. And by doing that, I believe that they will feel so empowered to make great food that is responsible for the kids. And then, in that sense, the kids can come in the kitchen, they can start cooking, and then that way, when they grow up, they have a little bit more of control of what they're eating. And at the end of the day, I think that, you know, self-esteem and productivity is going to be reflected on that. So that's my commitment to the Alliance for a Healthy Generation, and thank you so much for the invitation. I hope you guys, let's move to that side and let's start eating. I hope you like it. Thank you.
Well, congratulations, Chef Lorena. Yo estoy muy emocionada. I'm so excited. And of course, thank you all so much for being a part of our great panel. I'm really looking forward to this spring in an effort to continue lasting change in tandem with the Alliance and the Clinton Foundation. Hopefully, one of the schools near you will be home to one of our recipes. Yours are coming out this fall across the nation as part of our Healthy Schools Celebrity Chef program for more than 10 million kids every day at lunchtime. We are so excited to get started. Hope you enjoy. Share with us feedback.